Well, back in the early 1980s, I was working in New Orleans at a shelter for homeless adolescents and runaway adolescents. And the children had been horrifically abused in many cases. And we had very limited funds to work with them. In fact, we only had enough money to house and feed each child for 21 days before trying to find some sort of placement for them. And in many cases at that time, foster homes were as dangerous as the settings from which they had come. So we were really desperate to try to make a difference. We were funded by 3 churches, and there was very little extra money. So I was desperate for a form of therapy that would be able to do the maximum good in the minimum amount of time. And because of that, I became interested in the work of Steve DeShazer, Insoo Kim Berg, and their team. And of course, fortunately, the approach was highly effective with this population. Well, there's an inherent respect and optimism in the solution-focused approach that is very appealing to me for a variety of reasons. My work has centered primarily over the years. I've been a solution-focused therapist for over 30 years. And my work has primarily centered on working with disenfranchised populations, people who've been really down on their luck and really need optimism and hope and the counterbalance of experiences of profound respect, all of which the solution-focused approach provides when done well. Well, most other approaches involved a lengthy initial interview, if not several interviews, in which the therapist asks a great deal of questions about the history of the problem and tries to pinpoint the cause of the problem. And following that arrives at a diagnosis. And once they have a diagnosis, they then work very hard to come up with the best treatment based on that diagnosis. Often this will take 2 or 3 or 4 sessions. And during that time, very little has been done to make the problem better, if anything. Solution-focused approach, in contrast, begins treatment immediately by generating a description of what the client's life will be like once the problem is solved. Now, that doesn't mean that solution-focused therapists don't take time to listen to the client's concerns, their pain, their problem. Actually, we talk about the problem as much as the client finds it's useful and helpful to do so. It's just that talking about the problem in itself is very rarely sufficient. Usually much more is needed. And so solution-focused therapists focus primarily on how the client and other significant people in the client's life will be able to know that things are better, that the problem is gone, or it's being coped with so well it no longer is a problem.